Today we're going to talk about a very, very interesting topic, one that I think is highly shareable and one that's even borderline controversial and one that I think is going to stimulate a lot of conversations and comments at the end of the video. And I want you to watch it all the way through because what I'm going to do is I'm going to talk to you about 3 anti-aging procedures that may actually be aging you. And you need to know this and you need to share this with your friends and family and anyone who might benefit from this, because the intention of anything that's in the anti-aging category is to make you look younger and to defy aging. But what if those very procedures are actually accelerating aging and damaging the tissues? Wouldn't you want to know?
I have to disagree with Dr. Karam, a facial plastic surgeon in California, who puts out great YouTube videos on for the public, as do I. His theory is that these non-invasive procedures can actually make you look older and age you. I disagree with that. I think he got it wrong. I think that these procedures are valuable in the right hands. So now I'm going to give you my opinion about the pros and the cons of energy-based devices, lasers, and at the end, facial fillers and how they may impact facial aging. So let's first tackle heat-based therapies. And those include ultherapy, thermage, microneedling with radiofrequency, and something called Morpheus 8, which is really a microneedling device as well. And there are other devices out there, which I can't mention right now. But the question is, where do these fit in the whole scheme of things when we're trying to rejuvenate a face? And really, these are all tools that we can use, if used appropriately, can achieve good results depending on the expectations of the patient. So none of these devices can lift the face and do what a facelift can do, but they can improve the texture and the appearance of the skin and tighten the skin a bit. But it's not going to actually get rid of jowls and lift your face or your neck or anything else. And I think the problem arises with the messaging that people get when they go into an office, where some of the marketing surrounding these devices goes a little too far afield, and people have these expectations that they can do things that these devices can't do. Some of the problem surrounding this marketing and these thought processes actually center with the person, either the doctor or the nurse or the technician who's actually doing the procedure, because they also have some concept that these devices can do more than they can actually do as well. So we have to understand the whole framework. The patient has expectations, and the doctor or the nurse also thinks that these things can do more than they can do. And the truth is, there are limitations on what these devices can produce, but at the same time, they can still produce some valuable results for the patient who does not want to undergo surgery and wants a non-invasive procedure with little downtime associated with it. Now, there are some devices that I don't like right off the top. I personally bought a thermage machine about 20 years ago when it was first introduced. And I saw, after treating a number of patients, that some of the heat delivered by the thermage machine was actually causing some facial atrophy of the fat layer in the face. So I don't think any of these devices that say they can contour the face, meaning that they're going to have an impact on the fatty layer of the face, is of any benefit to you. In fact, it can have a negative effect on your ultimate improvement of your face. So the way it can do that is cause atrophy of the cheek fat pads and subcutaneous fat all over the face, which is, of course, negative. However, so let's just backtrack for 1 second. Ultherapy, I think, which is an ultrasound device that can impact the fatty layer of the face, I don't think has any benefit in terms of ultimately for the patient. I think it has a negative effect. I think Morpheus 8, which is extremely popular right now in many facial plastic surgeons' offices and dermatology offices, can have a very negative effect ultimately on the patient, because it can impact the fatty layer, which is deep to the skin, and can cause a recontouring of the face, because it actually is causing fat atrophy of the face, is a negative device. A third device, like thermage, also has that potential to cause facial atrophy. How about microneedling with radiofrequency? Well, microneedling with radiofrequency, if it is done in a conservative way, where the level of treatment does not go too deep within the face, meaning it doesn't penetrate into the fatty layer of the face, I feel can have a very beneficial effect. And I have seen it occur with my patients, where their skin and their face looks more rejuvenated, whether it's a mild tightening of the face or a improvement of the skin quality. I have seen personally in my patients. And so I think if it is done properly, and there's ways to gauge on how deep the microneedling treatment can be performed, I think it can be a benefit to a patient who does not want to undergo surgery. One problem is that some practitioners only have a device to treat a problem. They don't look at it in a broad sense of the word. Sometimes people require surgery, and some people can have non-invasive procedures to achieve great results. So if you only have a hammer and the whole world looks like a nail, then that's a problem, because there are doctors and other practitioners who have purchased these devices, which could be $100,000 or more, and they feel like, well, that device is sitting in the corner of my office and I should use it on everybody walking through the door. That's a mistake, okay? Unless the practitioner really analyzes their results and they really are honest with themselves as well as the patient, they know when to apply these devices and when not to offer them to a patient. For instance, there are patients who come into my office and I say, you know what, you have very little facial fat on your face and your skin is very thin, and therefore I do not believe microneedling is going to improve your appearance. In fact, it may have a negative impact on your appearance and may make you look older than you are now. Therefore, I am not offering this to you as a treatment option. There are other patients who, due to their particular facial features, I feel can get improvement on their face and their neck with a microneedling device. It's not going to give them a facelift, but it's going to give them a more rejuvenated appearance. And therefore, they are good candidates if done in a conservative manner. If these devices are pushed because by the practitioner, whether that's a technician or a nurse or a doctor who thinks more is better, they're going to end up with a very bad result that actually is harmful to the patient and is not going to be of benefit to the patient. Therefore, you have to know the limits of how far to push these devices in order to get a result. It's not more is better. It's trying to hold back and say, we're going to do this in a conservative manner. We're going to watch to see how you react to the first session, and then evaluate as we go along to see if you need anything further. We don't sell these as packages, like you got to do 3 of these to get the result. Okay, that's good for a beauty parlor. It's not good for a medical office. Okay, so what I'm saying is everything has to be evaluated and judged based upon the reaction of a patient or based upon what they appear to be when they enter the consultation. Dr. Karam's example of the Morpheus 8 or Ultherapy or one of the other heat-based devices penetrating into the fat layer, yes, it is possible for that to occur. However, if the person performing this procedure knows not to do that with the devices like a microneedling radiofrequency device, which delivers heat to a more superficial layer. And what it does is actually stimulate collagen production, okay? It improves the skin by creating what's called heat shock protein, which stimulates the fibroblasts, which are the cells that produce collagen, to lay down new collagen. And so it does have a beneficial effect on the skin. So it's not just those devices that go very deep into the fatty layer and cause atrophy that is really where the problem lies. It's not the device itself, it's the person using the device and how aggressive they are with the device that precipitates the problem. Next, we're going to talk about lasers. Yes, lasers that deliver a lot of heat, like carbon dioxide lasers, deliver a lot of heat to the deep layer of the skin. And yes, it can cause depigmentation of the skin, which means it can lighten the skin and kill off the pigmented cells in the skin. Sometimes that is not a desirable result of having laser treatments, and it can also deliver a lot of heat. Again, if it's repeated over and over again to the deep layers of the skin and to the fatty layer, and in those cases you can get some facial atrophy. But I have seen great results on patients who've had laser treatments. It eliminates lines and wrinkles and tightens the skin, and it can be a very useful device to use, particularly as an adjunct to, say, having a blepharoplasty or cosmetic eyelid surgery or a facelift. Sometimes you want to rejuvenate the skin, and a laser is a very effective way of tightening the skin and as well as rejuvenating the skin and eliminating a lot of sun damage. There are other lasers, of course, that we use for pigmented lesions on the face, or vascular lasers, which we use to get rid of a lot of capillaries that are budding out of the skin, usually in sun-damaged skin. So lasers are extremely useful, and they're not necessarily going to cause accelerated aging unless they're misused or used in very powerful ways that they were never intended to be used to begin with. And just like the heat-based devices that I had previously mentioned, lasers cannot lift the face. They can tighten the face up modestly on some patients, but it cannot give you a lifting effect where you have a facelift-like effect. That can only be achieved with surgery. So last up is facial fillers. Do they actually cause accelerated aging? And my view is they do not cause accelerated aging. I don't believe they accelerate aging. They can make you look older, but they don't accelerate aging. And the difference is that as we age, our faces become more rectangular in shape. We have jowls and so forth. Everything starts to fall down. You get hollowing and so forth. A youthful face is more oval, okay? So if you fill these areas with, in a person who has a rectangular shaped face, you're now changing the contours of the face, but you're not, and it may not be beneficial to the patient. They may actually not look younger because you've put fillers in and you're not really changing the contour of the face. So in an older person, fillers are not necessarily beneficial, except there are areas on the face where they may be giving you a little more youthful appearance. For instance, around the mouth, you can fill in sometimes fillers, or even on the cheek, over the malar bones here, you can put some filler in a modest amount, and you can make the person look a bit younger. It's not going to change the contour of your face, however, in terms of the overall contour, and that can only be done surgically. But I don't think these fillers actually cause accelerated aging, and that is a statement that I think is a little bit extreme. So in summary, we talked about energy-based devices, things to avoid. I would avoid Ultherapy, Morpheus 8, anything that is overly aggressive in terms of penetrating into the fatty layer of the face, causing facial atrophy. Lasers can be beneficial if they're used correctly and not overly aggressively and repetitively, where it's going to cause facial atrophy, again, due to heat, the delivery of heat. And the third category, of course, is facial injectables. The fillers, I do think, can be of benefit for the patient, again, who is not a surgical candidate and wants to look a little more refreshed. It can make you more refreshed appearing if it's used in a very careful way and selectively on the face, so that you don't overfill the face and make it look worse than it did when you came in the door. So I hope my view and my take on this subject is of benefit and gives you a little more insight into how these non-invasive procedures can be of benefit for you or can be harmful for you, depending upon who is doing the procedure as well as how much procedure is performed. If you learned anything from my video today, you should ask questions. Who is treating me and how are they treating you? Those questions are critical in terms of getting a good final result. If you have any further questions, please leave them below. Subscribe to my channel. I'm trying to grow my community and answer all their questions, and I look forward to seeing you again in my next video.